You got to make sure you wash your hands.
Nurse Whitney Abutin preps to make her rounds at Rady Children's Hospital. And today, she's not alone. Hoover High School student Yadira Calderon follows closely behind. The two gear up with gloves and head into the room of a young patient.
What's your name?
Isaiah.
Isaiah, nice to meet you. So we're just going to do some vital signs.
Abutin checks his temperature, blood pressure, and asks about his appetite. All the while, she narrates what she's doing to Calderon and fields her questions.
How often do you take blood pressure? Is it every time you check in? Or?
Yes, so each patient is different.
This shadowing experience is just one of several that Calderon received during the semester. The high school senior is part of the Faces for the Future program that provides in-the-field learning for students from underserved communities. That includes San Diego City Heights neighborhood and 8 other cities across the U.S., such as Oakland and Detroit.
And our goal is that these kids graduate from college and get a well-paying job in the healthcare field.
Mary Beth Moran oversees the Faces program in San Diego. She says it benefits the students because the wellness education and career preparation help address poor health factors that often plague communities of low socioeconomic status.
And by educating these kids, particularly in the healthcare profession, it not only provides them a means to go for a degree in health, but also increases their knowledge of health to help themselves and their well-being now.
It also serves the industry. The program helps boost the pool of medical professionals to meet future workforce needs. Researchers predict a shortage of up to 120,000 medical professionals by 2030. And it ensures workers are as diverse as the population they serve.
The demographics of our country are changing, and with the Affordable Care Act, more and more people can access health care, and we want to make sure we're providing culturally and linguistically appropriate care for that population.
Faces for the Future alum Wendy Mejia is just one example. The bilingual speaker and 2011 high school graduate is now working for the hospital's Center for Healthier Communities. She works on injury prevention with Spanish-speaking parents at national city schools.
So that could be implementing a volunteer safety patrol program where we have parents come out to the schools during pickup and drop off and help supervise and be the eyes and ears of the school to ensure that the kids are safe during those hectic and very traffic congested areas.
She says the program introduced her to a variety of opportunities in the healthcare field and taught her what she did and didn't like.
What I learned then, I wasn't good with interacting with patients that were severely sick. It really hit a spot that I wasn't comfortable with.
Now her job is to help keep kids out of the hospital in the first place. But current program participant Calderon says she learned her role is within a medical center. The Hoover High School senior will graduate in June, and like many of the program's participants, she'll be the first in her family to go on to higher education.
I'm aiming for a doctor, like a MD, honestly. But I'm keeping my options open right now. I only know I want to go into emergency medicine or public health, and I want to take that into a global aspect, so in the global health field.
The program hasn't tracked how many alumni have in fact entered the healthcare industry over the nearly 10 years it's been in San Diego, but local organizers are working on this. However, the future of the program may look different here. Its major funding source runs out this year. The hospital is working with San Diego Unified School District to pursue federal funds to keep supporting it. Taryn Mento, KPBS News.